Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins. Joining us today is Pepin County Health Officer Heidi Stewart to talk a little bit about the COVID-19 update. And Heidi, thank you for joining us. Well, let's first talk about testing. It seems like those numbers keep kind of going down.
Yeah, so again, I do have my daily update that I can share with you guys. Not daily, it's weekly, I'm sorry. I thought I had this organized and I don't seem to be getting this pulled up for you guys very quickly. As usual, I'll talk through it. So are you guys seeing, or Brian, are you seeing the document that says Daily COVID County Summary Report?
Yep, we now see it.
Okay, wonderful. Let me go ahead and I don't want to mess with this. I think there's some key takeaways here in this daily summary report so that the people that don't have access to view it know. We are up to 800 cases. We are getting a couple more cases in pretty routinely. We had a pretty busy stretch there. Well, I shouldn't say busy, but a more active stretch where we had 11 cases over a span of a couple days. We are seeing some increase in activity compared to what we had seen the previous couple weeks. So the last couple of weeks, we seem to be seeing a little bit more again. No specific locations, no specific outbreaks, just randomly. We did have an additional hospitalization yesterday and one on the 13th as well. So our total hospitalizations are up to 34. Deaths are at 7. Sorry. So we are still seeing some activity, and the variant strains are a topic that are being talked about, I know, on the regular news. And I think it's important for everybody to know here that locally we've been pushing testing to Advent Health, and that rapid test they have doesn't necessarily test for those variants. It does test for a lot of things, and I'll talk about that in a second. But if people meet certain criteria, they do have the capacity to go ahead and forward that to the state lab to test for variants to make sure that we're getting a full picture of what we have here in our community. And thanks to Advent Health, one of the things they're doing right now is when they're running the COVID-19 test on the younger population, some of our students, they have the capacity to run a whole respiratory panel. So they're checking for influenza, they're checking for rhinovirus, they're checking for other coronaviruses, they're checking for COVID. And the report that I just got from the hospital a while ago was that they're seeing a lot of rhinovirus. So a lot of the head colds, a lot of those other things. So we do have some of that going around out in the community. We've been very, very fortunate with our influenza numbers this year because of the mitigation practices we have in place related to COVID. But we are seeing some of those typical cold and flu season viruses poking their little heads up.
Meanwhile, Heidi, I know that we have the vaccinations going on. And for side effects, we've heard about those, and it seems like that always happens on the second shot. But what have we been finding out or seeing from side effects, at least here locally?
Yeah, so this is a topic that I wanted to make sure that we talked about. So far, we've had about 1,500 doses of vaccine go into the arms of Pepin County residents. About 17 or a little over 17% of our population has been vaccinated with at least one dose. Only 3% of our population, 3.3, I think it is, 3.3% of our population has been vaccinated with 2 doses. For the most part, people are experiencing some mild side effects related to the vaccine after the first dose. Notably a sore arm, mostly some pain, tenderness at the injection site. And I will say, yes, I had that with my first dose. What I want to talk about particularly is after that second dose, as we are approaching a week where 4 weeks post our biggest week in Pepin County, which was over 700 doses, we'll be having 700 people in this next week getting that second with their first dose, getting that second dose. So it is important that you do expect to have some type of side effects from that second dose. I don't want to discourage anybody from getting it. We certainly need people to follow up and get that second dose. However, fever, fatigue, headache, chills, muscle pain, and joint pain can occur after vaccination. It appears as though individuals who have had COVID-19 prior are having a little bit more of a robust reaction. Their immune system is reacting more, thus causing more of the side effects. Some good news for the elderly population. I shouldn't say elderly. Some good news for those over 55 years old. You do not seem to, your group does not seem to be having the same degree of side effects as the younger people. So in healthcare professionals that were the ones early vaccinated, we're seeing about a 50% rate of people having those side effects. So making sure you have plans for taking a little bit of a rest and sticking close to home that following day, so that you can just rest and relax and recover. The good news is it lasts about 1 to 2 days. Typically does start. The onset is typically within 3 days of getting that vaccine. Particularly the day immediately after the vaccine is when people are having a lot of symptoms. I also want people to know that cough, shortness of breath, runny nose, sore throat, loss of taste, loss of smell are not post-vaccination signs or symptoms. Those are actual symptoms of COVID infection. So it is possible that in the time before your vaccine, you could have been exposed and could now be having some of those actual COVID signs and symptoms. So a lot of information there. Certainly, if you have any questions specifically, you can call the health department. I can work on getting something posted on the website. But I will speak from experience that, yeah, I ran a fever. I ran what I would consider for myself, over 100 degree fever for a short time period on the day following. So, yeah. That's some bad news that goes along with the good news of getting vaccinated and getting protection out in the public.
Heidi, you mentioned with somebody may have contracted COVID and then they're getting that second dose. Have you seen anything, studies that says, well, you know what, because you've gotten that second dose, it's going to actually, even though you got the COVID, it's going to help maybe mitigate some of the effects of COVID? Because you got the vaccine?
When I have seen it, which it's only been a couple, it's only been a couple of situations where somebody got the vaccine and then the following day they developed a cough or a sore throat. Those are not symptoms. Those are not side effects from a vaccine. Those are symptoms of COVID. So it was after that first shot. They went in, they worked at a healthcare facility. They went in, they were tested, they tested positive for COVID. So at that point, if you get a shot on day one, you are not going to have the protection from that vaccine that you need in those immediate days. So I don't see that helping them at all in that situation.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. And Heidi, the state of Wisconsin's adopting some of the CDC guidelines on quarantine and the vaccine. Tell us about that.
Yeah, so this is the good news that I have related to vaccine. CDC came out last week in the state of Wisconsin. Department of Health Services has adopted the guidance that allows people who have had are 14 days post their second vaccine to not have to be quarantined if they're fully vaccinated. So it's been more than the 14 days with the two full doses. If they are within 90 days of that second dose, and I'll talk a little bit more about that, and they are asymptomatic. So certainly if you are exposed and having symptoms of COVID, we need you to go in and be tested and then potentially have to isolate or quarantine. But if you're asymptomatic, for example, in our system now and in the health department, we have people who are fully vaccinated because they are 2 weeks past their second dose. It's possible that we could be exposed in our line of work, but as long as we're within those 90 days and we're symptom free, we don't have to follow the quarantine guidance as those that are not vaccinated. Some people may say, well, 90 days, we think the vaccine is only good for 90 days. I think we'll learn more information on that, and this guidance may change as time goes on. What we do know is that 90 days post that second vaccination right now, it appears that there is coverage. So they feel comfortable up to that 90 days. And as they are comfortable with longer time frames, they will hopefully keep bumping that out.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. So getting the vaccine out, are we still receiving supplies? Are we still able to get that? I know that some state legislators, especially representing areas in South Central Wisconsin, like in Green Lake County, they say we're not getting anything, or we're getting very little. What's it like here for us here in Pepin County?
Okay, so the pendulum of good news or bad news, good news, bad news will swing back to the bad news side. The state of Wisconsin is still only getting that certain allocation each week, which is around the 70,000 doses for the entire state of Wisconsin. There are a lot of vaccinators across the state. There are a lot of people wanting to have control of those doses and to be able to vaccinate their residents. We continue to be aggressive here in Pepin County with Heike, Advent Health, and ourselves requesting those doses. For the last 2 weeks, we have only received 100 doses for Pepin County. So you can see here, I'm assuming you can see my screen now, and for those on the call, it shows the vaccine doses for Pepin County residents by week, and we slowly ramped up during January. We had a really good week with 735 on the week of January 24th. Our allocation was cut down that following week on the 31st to 270. The following week on 2/7, our allocation was only 100 doses. So what we're seeing here is that 148 people in Pepin County were vaccinated. So 1/3 of those were vaccinated outside of our county because we only got 100. And then the data isn't completely in for the week of February 14th yet. It's only showing 23. So while last week when I shared this heat map, and it showed us at, I think, 16.9% with our small allocation, we're not moving this needle very quickly, at least not as quickly as we were in the past. So we're at 17.3% now. We can skip over and see the percent that have received a complete series for Pepin County. And this map actually, while the other map and our first doses, we look really good. On this map, we have a fairly lower percentage of people who have received their second doses. Oh, it changed since I looked at it earlier. It's bumped up. We're at 4. Oh, no, that's a state. We're at 3.3%, I believe now, which actually, if the state's only at 4.4%, that's not too bad. Long story short, we're trying to get the vaccine. We're requesting as much of it as we can. But at this point, due to our population size and due to the fact that we are ahead of the curve for people getting that first shot, we're getting fairly small numbers allocated here to our county. Next week, we'll be getting some big shipments. It looks like we're going to get another 100 first doses. And next week, we'll be getting that shipment of second doses, which should be over 400 for us, 400 for the hospital, and a couple hundred for.
So Heidi, let's talk a little bit about sign up for the vaccine. There's going to be some new ways to sign up?
Yeah, so along with those second doses that we're going to be doing next week, we are going to try to jump right in with that phase 1B eligible group. Of course, we had the wait list for phase 1A. We had the wait list for the 65 plus. We continue to work off of that wait list. The health department version of that wait list looks really good. We actually sent an email to every single person on that wait list last week saying, hey, sign up for these. So, there's some that couldn't make it on the date and the time. But we actually took that wait list offline, and we're starting a new one, which I'm going to go ahead and share with you guys. So if you go to the Pepin County website under COVID, you can click on sign up for the wait list. This is what it will bring you to. It talks about March 1st, opening up vaccine to additional individuals on the eligibility list. We really, really, really use this list. So if you qualify under these different categories, which are education and childcare, individuals enrolled in Medicaid long-term care programs, it does list some public-facing essential workers, utility, communication, infrastructure. It does mention public transit. We don't have a lot of that here. It mentions food supply chain, agriculture, production workers, and those that it mentions retail food workers. It mentions our food pantry people. So I would encourage everybody who thinks that they may be qualified to go ahead and visit this list. It'll ask your name. It'll ask your phone number. It'll ask your email address, but that's not required. We are still collecting current age because we want to make sure that we're getting all of those 65 plus. It will ask the eligibility group that you qualify for or you believe you qualify for, which it lists the 1A, it lists all those phase 1B that I just mentioned. It does ask for a name of employer. If you don't have that, you can just put not applicable. And then it lists, it asks what county you reside in. So this is actually going to be going out on our county website as updated. So Brian, I know you work a lot with our farming community and some of our other community. This is definitely something I would like you to share with them because we are going to be using this sign up list as a way to get to those individuals that are wanting the vaccine.
Yeah, and I noticed as well, Heidi, that farm owners and other farm agricultural workers are going to be part of this as well. So farm owners, yourself and your employees on the farm are going to be part of this next phase that is starting. So, and veterinarians, especially livestock as well, livestock breeders as well. Again, farm labor folks. So if you're in agriculture, this is going to be your time to be able to get that COVID-19 vaccine. And again, Heidi, this will be the one list I know that there's been in the past, we don't want to have people signing up for multiple lists. So this is going to be the one that folks really need to just, if they sign up on this one, Heike and Advent are going to be known about this, right?
So we don't share the list. We don't share names. Heike Pharmacy doesn't share the names of the people on the list with us. The hospital doesn't share. So for example, right now, our wait list is almost depleted for those 65 plus. So I've called those establishments that haven't gotten the vaccine in the last couple of weeks and said, can you let your individuals know? Instead of them giving me their list that gives me access to a lot of maybe personal information, phone numbers, ages, names, they're giving their people the message that, hey, we don't know when we're going to get the vaccine. Call the health department, go to the website of the health department, get on that list. The only thing we ask is that if you do get on multiple lists and you do happen to get an appointment or you happen to get your vaccine, please call the other people back because then we'll just remove you. It's really not a big deal at all to remove somebody. We really just want to make sure that everybody's getting the vaccine.
All right. So again, folks, agriculture workers, if you work on the farm, if you own the farm, if you help out on the farm as maybe an agronomist, work at Countryside Co-op next week with the Phase 1B, that is your time to sign up. Again, visit the Pepin County website as well for that link. Well, Heidi, again, some good news. And again, we appreciate you joining us today.
Thanks, Brian.
Heidi Stewart, Pepin County Health Officer. You're listening to WRDN.